Welcome, everyone. I would like to welcome all of you from all around the world. We have hundreds of viewers already, and thank you for your time and that you invest in how you can improve your learning and your studies, even in these challenging times when, due to COVID and the spread of COVID, all schools have been closed, and you have to somehow figure out how to study medicine and how to study practice on virtual on patients at all, but without going to hospitals or medical schools. And this is why we came here together, so that we can show you some ideas how you can improve your diagnostic skills, clinical reasoning skills at home very conveniently with the InSimu patient app. My name is Gabor Todt. I'm one of the co-founders of InSimu. I'm an MD by trade, and also we're teaching medical at a medical school, medical students during my years there. Now I'm focusing on developing InSimu, a tool for you so that you can practice and gain larger experience in the diagnostics and clinical reasoning everywhere around the world on virtual patients. Today's workshop is going to be as follows. I hope that you see my my presentation. It is first just some basic technical information. We have a chat box on the right side on your screen where you can have questions for me, and we can discuss those after at the end of the workshop or in the middle as well. And also we are recording this small workshop, and we can share you the video afterwards, so that if you missed anything, you can still watch and go back to those parts that are most interesting to you. I will focus today on how you can use InSimu in your studies. I will show you a case presentation as well, not with the aim of teaching you how to perfectly diagnose a patient. You have your professors and the InSimu app for you to do that. And my aim is to show you the technicalities, how we can help you most efficiently. So I'm ready to answer all those questions for you. And if you go forward, I will show you how I usually solve a case in the InSimu app. And I will share my screen so that you can see the screen of my phone and see how I usually solve a case. Then I will try to give you tips on regarding that and how you can further improve your skills. And I will also show you how you can suggest your school implementing InSimu in their curriculum now as well and later, because we have many features for educators as well, that are completely different than what you usually see in the InSimu app, and they're very interesting for you. They should be very interesting for you as well. All right, let's get down to business, and I will share my screen. That is going to be the screen of my phone, and let's start with a case. Bear with me. All right. So this should be, this is the screen of my phone that you are very used to, the InSimu app. You can practice by symptoms or by topics, or just get a random patient, or also solve challenges that we made for you, or maybe your professor created for you. I will today pick a patient. Let's see what's up with Eddie. Well, Eddie came in with symptoms of cough and bloody sputum and shortness of breath. He is 59 years old. It can be very interesting these days. Of course, the first thing that could come to our mind is COVID, because everything is about COVID nowadays. But let's see if it really is a COVID or something else. We can check the chief complaints. So this patient had coughs for a couple of hours. Well, it's weird. Why he came so early? Is it that acute or that bad? Well, certainly because he also experienced blood in. He coughed up blood and has shortness of breath. Let's see. Well, from this point on, we are House MD, and we have to start examining this patient. Although I could ask for any diagnostic test that is available in the app. I would now follow a more reasonable order, and I would go for medical history. So we had a cough, so I would probably be very interested in respiratory history. Let's order that and see what we can learn from this patient. Okay, so the shortness of breath, the onset was 3 hours ago, and it's continuous. The cough is also continuous, and it was bright red, the sputum. And he had that 4 times. Well, that's a lot. That seems to be a very severe case. Let's see more. I would. It could be something with the respiratory system, but also it could be with the cardiovascular symptoms. So I would order that one as well. What we learn about that. If you have new information here, indeed we have this patient felt a palpitation. Yeah, that was persistent. So it could be myocardial infarct as well, or something with the lungs, maybe a tumor, or maybe pneumonia, a very severe one. Well, let's see what else. The possibilities are very. It's a long list at this time. All right, I would see general patient parameters. I like to see that. So it's a male, 78 kilograms the body weight. I would also ask this patient if he experienced any weight change. It might be irrelevant, but or just rule out a couple of things. But let's do that. It's negative, so he didn't experience any weight change. I asked that if it's a tumor that could cause a change in the weight as well, although this rapid symptoms or acute symptoms that he's experiencing it has been only for a couple of hours now. Okay, what else? Let's see if someone else in the family is also experiencing similar symptoms. Family history is all negative, so others in the family did not experience these symptoms. Again, for COVID, they may experience that symptoms as well, or those symptoms as well. Let's see something more. Well, let's go for physical examination. Let's see vital signs. Okay, body temperature is still okay. It's a bit increased, but still in the normal range. Heart rate is high though. The rest is okay. Still oxygen chest saturation. Okay. Well, definitely we have to examine the respiratory symptom, the respiratory parts. We see that rapid breathing is present, and the rest seems to be normal. with the palpation, it's normal. Auscultation, the breath sound is decreased in the lower and middle lobes. Well, this could be still many things. Also pneumonia, maybe. Well, let's see. I would still ask for a cardiovascular physical. Yes, certainly the heart rate is increased. We can check that as well. We see a bit of a difference. As far as I remember, previously it was 107 and now it's 110. It is normal because with different tests, you measure different, the same parameter can be measured a bit differently. The different tests have different sensitivity, or also they may also be changes minute by minute. So it's totally normal. It's with an error. All right, let's see. Well, I would also be interested in if it's a very acute case and it's an older patient. I want to rule out thrombosis and pulmonary embolia as well. So I would order a lab test for that. Ddimer is one for that. So I just search on that. So we have Ddimer. Well, it is completely normal, so it might be that it excludes that. I'm not sure about that. But as far as I remember, Ddimer should exclude that. So what else? Still, there, if it is an MI, I would just order an ECG just to rule that out. Okay, it's a bit irregular. And sinus tachycardia. It's also non-specific ST segment and T wave changes. And there is strain pattern, so there should be something with the lungs. I would do a CT just to be sure. Let's go into the imaging CT. Okay, chest CT. Okay. I can see the findings. I usually have a quick look on the impressions because I'm not a radiologist. I later go on to the findings. Further examination is required. Enlarged right ventricle and dilated central veins. I can check that in with the details. All right. Well, if this is the case, I need a more sensitive test. I would do a CT angio. Maybe it's still a pulmonary embolia. Let's do that. CT angio. Okay. Pulmonary CT angio. All right. It took me over $500, but let's see if it was worth it. Yeah, there is a submassive pulmonary embolism affecting the right main pulmonary artery. So it is actually pulmonary embolism. It seems like that, and I believe that a CT angio is very specific test. So I am now sure that I should select this diagnosis for this patient now. So I wouldn't not do any further testing and just go for the diagnosis. I usually do the search for ICD-10, so pulmonary embolism. All right, what do we have here? It is not chronic. It is an acute case. I could go for pulmonary embolism, NOS, or with cor pulmonale. Yes, I would select that because I saw that there is a strain. There was strain also in the ECG, and we saw that in the CT as well. Let's see if it works. It did. Okay, although my spending was significantly higher than the optimal, although the turnaround time of the tests were not a lot more than the optimal. I still missed many tests, mostly the histories. I didn't ask for medications and other diseases. I forgot to do that, but it is very important, I know. Sorry, guys. And pain was also missed. Let's see what I performed. Yes, respiratory history, it was great. This is part of the optimal pathway, family history as well, vital signs as well. Ddimer was also okay. It was part of the optimal testing, although I'm not sure how it can happen that we had a pulmonary embolism with negative Ddimer. I will check on that. And yes, I see that the chest CT was probably unnecessary, because if I had pulmonary embolism in mind and I wanted to rule that out, I should have picked pulmonary CT angio in the first place. And in that case, I would have spared the cost of the chest CT. That was $300 and took me 22 minutes. So if I'm unsure of something, what I do is not only just finish the case and start a new case, but do a bit more deep dive so that I remember more on what I've learned, what I've experienced with this patient, and why I did those mistakes. So I would, what is interesting to me is it's Ddimer negative. Could this happen? And I usually just Google that, Ddimer negative with PE. What is there? If Ddimer, it says that it usually excludes pulmonary embolism. However, not always. Severe pulmonary embolism and negative Ddimer testing. I find peer-reviewed literature on that. I could go into that and see what they found. But it was very interesting. I saw this this decision tree. It shows that if the probability is very high, then we cannot use the Ddimer test to exclude thromboembolism. Let's see what it shows us. So clinically, probability score, if it's very high, then we should already do IP, testing for pulmonary embolism or deep vein thrombosis, and we cannot use Ddimer test to exclude pulmonary embolism. So that's very interesting. Anyway, it was a fairly good solution for the first try, and I gained a lot of XP points, and I improved in medicine and internal medicine. Okay, I hope that you like this. This case that found that as exciting as I did here. And I would go back to sharing my presentation. And if you have any questions, I would see some of those. Let's see. Okay, I have a question here. I would publish it now. See the Q&A questions. So how can I check and review the patients that I already diagnosed? You can do that, indeed, and you can, if you have questions, you can go to see your professors. I would go back to sharing my screen. To show you where you can find your previously solved cases. So this is the app, and This is where I got back the main screen, and under profile, you can see also achievements, but also patients that you've solved. So you see that this is the patient, Eddie, that we've just solved. And if I click on that, I can see the results screen, just like I left it. I can see my previously performed tests, and I can also see, click on those tests that I ordered and see what the result of those tests were. And I can also check those tests that I missed. If I cannot click on that, I cannot click on the pain. It was a negative, completely negative in that case. This way, you can go to your professor, share the screen with them, and discuss the case together. You can also do a screen share with your professor while you do the case, just like I did for you. Actually, they can do the same thing, and you can think together. But let's talk about that a bit later. So again, if I go back to the to our little agenda, I solved the case, but after solving a case, I would not jump into another one, although you have an unlimited chance and unlimited access to the cases if you have the premium version. Still, if you go into a bit more details, you can learn more about what you did right and what you did wrong. You should make notes as well, and that you can review later. Write up your questions so you do not forget them. And when you have the next seminar with a clinical teacher of yours, then you can ask them those questions and review the cases, or maybe share these screens with some of your friends and discuss the cases together, and maybe they have ideas and they can help you with those. And don't forget to read peer-reviewed articles and also peer-reviewed sources like UpToDate or any other sources that you trust, and going with a deep dive also in the diagnostics and in the therapeutic parts of the patients. You may also start to think what the first treatment option would be, would you give for the cases that you've just solved, so that you also experience that as well. Okay. Now, but why do we focus on diagnostics so much? It is because that is something that is maybe the most difficult to practice and to gain experience in, because about treatments, you can read about them and you can anytime do a quick research or a quick search on what the right treatment for your patient would be to follow the guidelines. However, when it comes to diagnosis, it is something that is very complex, and you don't have time to go into more details in the publications. You have to know it by heart, and you have to be ready to make the decisions. And it is also the hidden part of the iceberg of all medical errors. This is an image created by the Society to Improve Diagnosis in Medicine in the US, and they bring the attention that that most of the cases where medical error happened was due to diagnostic errors, and 12 million patients are misdiagnosed only in the US every year, and this causes huge harm and cost to the patient and the society as well. And also, actually, it is a top reason for malpractice suits against US physicians. I'm talking about US data here because they have very detailed statistic analysis. For your country, if you're from outside the US, you could also search on your metrics if you have those, or just you can think and extrapolate on these numbers and see, think what the situation in your country could be. Nowadays, it is not difficult. The only difficulty is not only for you to practice on patients, but it is also a huge challenge. COVID poses a huge challenge for your school, for your educators, professors, because they want to show you, share patients with you, but they cannot let you in the ward or hospital. So they cannot do that, and they're also they may be overburdened with the as they're also healthcare professionals with taking care of patients. So they need to find tools that are very easy to use, scalable, so they can share the cases that they like with a large number of students. And they should also see the performance of the students. And this is actually something that we developed for the educators. And this is something extra that you see. You see an app when you practice during your self-learning on your smartphone or tablet, an infinite number of virtual patients. But what the educators can also have above or beyond that is another layer of functionality that is only available for them, but you can let them know about this option. They can pick the cases, the virtual patients that would fit the study program of yours, and they can share it with you, and they can give you homeworks, and you can do the cases, solve the cases at home. And your professor can see how you performed during the course, the little course that he created for you, and he can help you. He can organize your debriefing sessions, and you can discuss cases together. So what they usually do is they find the scenarios from the pool, from the InSimu pool at home. They assign the cases, they create small challenges that you are also used to if we create challenges, but they can do that as well, and they share it with you. Then they can evaluate your performance at home and organize a debriefing session. And you can go through your questions, or you can they can go through all the pitfalls that most of your students usually have. So you can have a better understanding on the differential diagnostics of those cases that were selected for you by your professor. And then they can adjust the level of difficulty, maybe give you more cases or more difficult cases, or with different diseases or symptoms. They can also share the screen with you, their screen, just like I shared it with you. And if there were not so many viewers, we could have made it more interactive, and I could have asked you what diagnostic tests you would like me to order, and we can solve the case together and think together. This is something that you can do with your professor, or just with some of your friends, and learn together. It may be even more engaging. Or participate at a diagnostic championship that we also organize yearly with IFMSA. And I may also want to share this screen with you. packages, support packages that we created for your school and for you, you can get access to the InSimu premium features for 30 days for free if your school requests it, and you can gain access to your school, and they can also implement it rapidly in their curriculum. So still by the end of this semester, they can organize courses, or maybe organize exams if you want to have exams within InSimu, to assess your skills objectively. If you're a experienced InSimu user, an exam in InSimu will not be a big challenge for you, so you can get a very good grade at the end of the semester, and because you already gained a large experience if you practice with our app on dozens or hundreds or thousands of cases. We will, as I mentioned, we will send you the video of this webinar. I will still have time for some of your questions, and that I will try to answer. And you can also reach out to us at support@insimu.com, but one of our co-founders, Andrea, will also reach out to you and share you details about this webinar and how you can use InSimu in your curriculum as well. So let's see some of the questions if we have time for that. All right. I would go to questions. This is the previous one. I just signed up. I have automatically sent the page to solve the case. Let's see if I can answer this. I just signed up and I have been automatically sent on a page to solve a case. How do I get out of the page? So when you log in the app, the first patient will appear automatically, and you have to go through that case. If you can try to solve that perfectly, or if you just want to skip that, you should go to diagnose that case, or there is also a possibility to give up. It means that you would refer it to a specialist. At least you have to refer it. You cannot quit from a case. This is a policy that we have created. If you have a patient, you do not leave your patient without help, without taking care of that patient. So so you have to try to diagnose that patient. If you may also have experienced that if you start a case on your phone and either your phone dies, the battery dies, or you just want to switch to your tablet, it will continue from where you left with your phone or your other device, because all your accounts are connected, and this is how we can make sure that you will help all the cases that you have been assigned. And it is the same thing with the courses. If you start a course, well, you will have, actually, I will show that to you. Go back to the app and tell you a bit more about other features, because it looks like there is a need for that. Open browser. Okay. So as you see, if I start with a new patient and I think I don't have time for this patient, I can just go and diagnose, or I can, on the right upper corner, there is the I don't know button, which is practically I give up, but you cannot actually pass a patient without sending it to a referral, so to a specialist. Let's say I didn't even check the case. Sorry for that. I will send it to a general internal medicine and see if it was okay. And you can also see the right solution for this case and see all the open all the missed tests that should have been ordered for this case. Well, of course, I didn't get any experience points for that. I will also show you something more, which is if you're stuck with the case. There is this new case, Leslie. If you really do not know where to continue, but you do not want to pass this patient and do not want to pick just a random diagnosis for that case, you can go to the under these 3 dots, ask for a hint, order a missed test from the pathway. You can do that 3 times. So you will be provided one of the next right tests that will provide you probably important information about that will help you go on the diagnostic pathway. This I find many times very interesting and important. Yes, and I would just quit this patient. Sorry again for just not diagnosing this patient perfectly because we do not have the time for that. However, if your professor creates a course, for example, a cardiology course, then you will find this course under the challenges menu after you type in the promo code of that challenge. And if I start this course, you see that I have 6 patients waiting for me in this course. This is the first patient. If I start practicing on this, I will have to continue and finish this course. I will not do that. I will not do that now because in that case, we don't have time to finish the course. And one more thing that would help you, even if in your self-learning, we have a report on your performance that is available only for you, so that you can look back on your weekly performance. And if you keep using InSimu regularly, you can see your improvement. You can set your own goals for your next week if you want to solve more cases or with better efficiency, better outcome. You can check this report and see your personal improvement. Again, this is for your self-learning so that you can spend your time more efficiently and create your own goals. And we want to support you with that. It is very similar to a assistant coach for you that helps you stay motivated even at home when it's you who has to set the goals. All right, let's go back. And maybe one more question for today. Is there an option for junior doctors for premium? So indeed, if you are a resident or junior doctor, or even an experienced physician or physician assistant or nurse, you can practice with InSimu, certainly. And we also want them to practice because although they may be more experienced than students, naturally, they also need to update their knowledge and to do that regularly, because guidelines may change and you always have to be prepared. I would give you another example. Airline pilots, experienced licensed airline pilots have to go through simulations, simulation practices, and do exams in simulators every 6 months. Even though they fly the planes every day, well, not nowadays, but in Europe, planes are grounded on, even if they fly the planes regularly, they have to show that they are prepared to solve emergency cases, scenarios that they may never face. We hope they will never face, but they have to be prepared for that. And me, as an airline passenger, I want to sit on a plane that is flown by a very experienced airline pilot. And your patients want you to be experienced and be always ready for the most extreme conditions, and you have to prepare for that in simulation. You can download the app and play with the app just like a student would do, or any other healthcare professional would do. How do I get challenges? Let's see. So the challenges, it's your professor, your teachers who can create challenges and share the challenges with you. They will share codes with you that you have to type in, and in that case, the challenge will appear under challenges. So you have to ask your professors to create challenges for you, and in that case, they can support you, help you, even remotely, without going into medical rotations, into hospitals. Okay, maybe 2 more minutes we have. Let's see. There is why don't I have free premium even though I've applied? You can have a free access if your school requested it. They have to contact us, or you can also contact us and ask our help to talk to your decision makers in the school, and if they did, then you will have access, or you can also just subscribe for the premium on your own and enjoy it in that way. If you feel that you have encountered any issues that you ask our help in, feel free to contact us through contact support in the app, or at support@insimu.com, and we're happy to help you if you have any issues. All right, we will send answers to the questions. For those questions that we didn't have time, I believe we cannot send you the answers. What we can do is share the video with you with this system, and this way you can review everything. Again, if you have questions, feel free to contact us, and we're happy to answer your questions and help you get access either through your school or help you in self-learning. I do hope that that this workshop was informative for you, and you could find relevant suggestions or ideas that you can implement nowadays as well, and in the long term, in the longer run, later when you start a new semester as well, because this is how it should be. You should practice continuously, course by course, symptom by symptom, topics by topics, and continue practicing, even if you already have your degree and you're an MD or DO or PA or a nurse practitioner, anyone who is part of the diagnostic team or has to make decisions in diagnostics or have to refer about tests, diagnostic tests, implement that or understand the diagnostic test result, they should have a larger experience, and they can gain us through virtual patients and through InSimu. Again, thank you for your time, and hope that you will continue diagnosing the patients happily, and you will have a great experience when you see a real-life patient. Have a good one. Stay safe.